This is Alex. He had a motor vehicular accident. As a result, he had multiple fractures in his shoulder and forearm. After months of physical therapy, he was able to move pain-free and do the activities he was able to do before the accident. One day, he noticed pain every time he ate and was eventually admitted to the hospital because he was unable to swallow. It was assumed that it may just be because of a muscle spasm in the shoulder and neck area. After another physical therapy referral, the pain totally subsided from his throat. But now, Alex complains of lower back pain until it was diagnosed that the real cause of the problem was liver cancer. How can cancer manifest with musculoskeletal pain? And how can you determine if the body pain that you have now is not something that needs immediate evaluation? When we hear about the big C, one cannot avoid but become fearful at the same time hopeful that this won't happen to you or a person you love. Sadly though, 1 in 5 men and 1 in 6 women worldwide develop cancer. Worldwide, the total number of people who are alive within 5 years of a cancer diagnosis, called the 5-year prevalence, is estimated to be 43.8 million. That's a big number. And the reason why early diagnosis is very important. One of the most valid concerns that I hear my patients say is if whether or not their symptoms are purely musculoskeletal in nature or is already a sign of possible cancer. So stick with me until the end of the video so you can spot the difference between musculoskeletal pain versus cancer pain. This video might just save your life or a loved one. Greetings again to everyone. This is Doc Sherry, Doctor of Physical Therapy. If you're new here in my channel, please don't forget to click the subscribe and the bell button below so you will be a part of our growing community and you will receive weekly health videos on a weekend that will benefit our beloved seniors, you, and your family. If you experience the symptoms that I will mention in this video, it would only be because of 2 things. Number 1, to give you peace of mind or to encourage you to seek medical advice whenever possible. Pain could either be localized or it can be a referred pain from other organs of the body. For example, the case of Alex, the low back pain was actually caused by a liver cancer. And the difficulty with swallowing was because of cancer metastasis that had affected his spinal cord and in turn affected the muscles of his throat, and the reason why he had difficulty and pain with swallowing. I believe it can be very confusing for you to differentiate one from the other. In this video, I will guide you through to help you determine if what you have is purely musculoskeletal in nature or if it's something that needs immediate medical evaluation. Number 1, if you have body pain and you don't actually know what caused it and how it started, consider to have yourself checked because most musculoskeletal conditions have an exact mechanism of injury. Number 2, if you have body pain, at the same time you or your family members notice that you lose a lot of weight without exerting so much effort in it, consider to have yourself checked. The question is, when can it be considered significant? It can be something that would raise an alarm if you have lost at least 10% of your body weight within 10 to 21 days, but you haven't exerted so much effort in doing so. Number 3, Pain that does not get better after you take some rest should cause an alarm, because most musculoskeletal conditions would manifest with at least a reduction of symptoms after you take some rest in one way or the other. Number 4, no position makes you comfortable. If it is the type of pain where you have changed your positions every now and then, and you don't find comfort in any of those positions, consider to have yourself checked, because most musculoskeletal conditions have certain positions of comfort. It means that certain positions could either increase or decrease your symptoms. So if the pain that you have is constant in nature, consider to have yourself checked. Number 5, if you feel pain that is out of proportion to the injury, have yourself checked. For example, in the case of Alex, a fracture in the humerus usually would not cause any problems with swallowing. In cases like this, you need to dig deeper because it might mean something else. Number 6, if the pain for sometimes that you feel can be relieved with any change in position, application of either hot or cold compress, or it can be relieved after you take some rest, and then eventually these relieving factors does not suit you anymore, have yourself checked. Number 7, if there is no discernible pattern of pain. For example, in the case of Alex, he first complained with difficulty of swallowing, and then when it was okay, the pain already transferred to the low back area. If you have pain patterns like this, please have yourself checked, because most musculoskeletal conditions are usually localized in nature, meaning it affects only one joint at a time, only in very small cases though, like rheumatoid arthritis, where it can affect the joints of the body, and it can also affect other organs because it is systemic in nature. Musculoskeletal pain is localized. Cancer pain is not. Number 8, this is very important. Please have yourself checked immediately if you experience the type of pain that is very intense and constant at night, that it even disrupts your sleep. This should raise an alarm because most musculoskeletal pain lessens at night. Thank you very much for watching. I hope that you find this video helpful. This video is a quick scan to give you peace of mind or to encourage you to seek medical attention when needed. Since this medical advice is for free, please don't forget to click the like button if you find this video helpful, and please share this video to your friends and family members because this video might just save a life. This is again Doc Sherry. Stay safe, stay healthy. God bless you.